My name is Alexis Cook, and for the past 15 weeks, I have been interning at Beech Consulting and Psychological Services. In 2013, Beech was founded by my supervisor, Dr. Robbie Crane, in an effort to promote the highest quality healthcare and psychodiagnostic testing to southern Indianapolis. Currently at Beech there are 5 clinicians, 1 doctoral student, and 1 intern, who this semester was myself. The 5 clinicians include Dr. Robbie Crane, Dr. Jessica Nycombe-Helms, Dr. Alyssa Hoffman, Dr. Kara Pratt, and Dr. Sarah Brown. All of them received their PsyDs from the University of Indianapolis and may have more extensive certification. Within their specialties, they all perform different things for therapeutic and diagnostic testing, as well as in different ages. Dr. Crane works with adults coping with depression, anxiety, bipolar disorder, personality disorders, dissociative identity disorders, and post-traumatic stress disorder. She also has experience in identifying disorders such as learning disabilities, ADHD, mood disorders, and personality disorders in all children, adolescents, and adults. Dr. Crane additionally has an International Association Trauma Professional certification, as well as EMDR training and certification. Dr. Jessica Nycombe-Helms addresses identity development, low self-esteem, relationship concerns, trauma and abuse, grief and loss, and disorders relating to mood, anxiety, and eating. Her psychological testing expertise includes identification of ADHD, learning disabilities, and personality and emotional functioning assessments in all children, adolescents, and adults. Dr. Hoffman specializes in treating childhood anxiety and obsessive-compulsive disorders, frequently utilizing her strategies for children with OCD, phobias, and related types of anxiety, in addition to comprehensive psychological evaluations for both children and adolescents. Dr. Pratt works with clients who have concerns related to anxiety, mood disorders, relationship concerns, and recent life stresses. She conducts psychodiagnostic assessments for children, adolescents, and adults for ADHD, learning disabilities, memory concerns, emotional functioning, personality testing, and general psychoeducation assessments. Finally, Dr. Brown also has a wide variety of experience working with concerns including anxiety, depression, trauma, autism spectrum disorder, behavior problems, ADHD, and parenting issues. She has special interest in working with children and their families to provide evaluation services for children that are up to 12 years old to assess for possible autism spectrum disorder, development delay, ADHD, anxiety, trauma and stress, and mood disorders. The psychological services offered at Beech and their clinicians have such a profound impact on their patients that I yearn to be that beneficial in the lives of others one day. Given this motive, I can see furthering my education to become a clinician. There is a long road ahead of me to start this goal, but it was one that I admire so much the roadblocks will truly be worth the reward. Finally, I gained real-world experience. Although I have had a diverse array of jobs before this internship, I have never had one in such a professional setting. Wearing semi-professional attire and working in the office of a private practice was very rewarding to me, even if just for practice. I learned many lessons that I will carry throughout my lifetime in any career setting that I may. In the semester that I spent working at Beech I mostly handled administrative responsibilities. These included, but were not limited to, answering the phone, checking email, checking in patients for appointments, scheduling their future appointments, taking intake application packets, scoring psychodiagnostic evaluations, entering insurance information to patient profiles, and entering follow-up documentation for the current patients were just a few of my responsibilities. Specific projects that I handled throughout the semester included formatting diagnostic scores, extracting patients with upcoming 18th birthdays, putting together binders for each clinician with important information about the practice and forms that they may need for their work, and grooming therapy notes to create spreadsheets of patients who had not had active appointments in the last 6 months. It was a pleasure to get to know all 7 of these women and their patients and I will truly always value the bonds that were formed through this mental health service. Here's an example of some of the projects I worked on while working at Beech. This is an example of a BASC-3 test that I would have scored on the Beech, and this is the scores that I used to format on the graphs. Although I was not able to use any of the scores, this was then passed to the clinicians to review the results with their patients. Many of the projects that I worked on at Beech contained confidential information and were difficult to display the actual work. Due to the nature of this is the best that I could do. This is an example of the BASC test and one of the graphs that would correspond with it. Throughout the semester that I worked at Beech, I gained confidence, knowledge, flexibility, and speed in my conversation, thoughts, and work. A majority of this growth I can contribute to the lessons of my coworkers at Beech, both administrative and clinicians. The flexibility and language and office style that I gained will carry with me and make me a stronger candidate in any future career that I may choose. This is an up-close view of my poster.